clinician, Dr. Jacob Sinkoff. Good morning.
Good morning. Thanks for having me.
I referred to you as our doctor. Is that okay?
The resident doctor, yeah, that's fine.
Okay.
Yeah.
Well, you are. I mean,
You are. I mean, we have a follow-up on some type of medical
Every month,
emergency
yeah.
that our family has gone through, and we run it by you at the end of it. So
Yeah.
Thank you for always providing the great care.
Not a problem at all.
You were there last week.
Yeah, I don't want to do any HIPAA violations, but yeah, I will.
You know, you have the golden ticket. You should have like a frequent flyer.
We do. We do have some frequent flyers. Yeah.
Yeah.
So, yeah.
Hypochondriacs?
Yeah. You know,
Maybe?
and, yeah. So we have patients we know pretty well.
Yeah.
I say see them out in town and say hi.
So, are there people when they walk in, you
Roll your eyes?
No, we like all of our patients, but there are some we get to know a little bit better
Yeah.
than other patients, and you know, a lot of it's just they don't have any other options, you know, besides going to the emergency department. And we're happy to take care of everyone that comes in, and a lot of times those are the most grateful patients where they have no other resources. So, there's so many resources in the community that a lot of times people don't know about. So a lot of times we take that as an opportunity to kind of let people know what the community has to offer in terms of resources.
Yeah.
So,
Well, let's talk sports injuries. We're in the middle of fall sports season, so it's happening.
Every Friday night, I've been working, or afternoon, we're starting to see all the football-related injuries. So, most common types of injuries that occur in sports, they've done a lot of sprains and strains. So things that can be seen at the urgent care and stuff like that. I will, like to remind people is once there's a sprain or a strain, it makes it so much easier for the injury to get worse until it's healed correctly. I know, at the end of a game, I tell people to come out of the game, but especially practice and things like that, sprains and strains can lead to more injuries. And nationwide, we're actually having, which is great, a larger participation in sports. I think especially after COVID, much more high school sporting activity, which is good.
Yeah, for sure.
JPEC coach Joe Moore last night told me his 7th grade nephew had torn ACL.
Oh yeah, we're seeing that a little bit. These young kids.
Yeah, and so researching a little bit, these they even have, I've heard, I think, radio ads for it, is trying not to isolate your child to play one sport.
For sure.
They've shown an increased rate of injury if children play one sport and specialize in only one sport. Also, playing multiple sports a season, they've shown increased rate of injury, probably just because of overuse more than anything else. But not having your kid focus on golf all the time, and he's probably not going to be Tiger Woods, and just
Good luck telling the parents that.
Yeah, and they've actually said, as you age, these kids, these athletes develop more higher set of skills if they participate in multiple different sports and not just focus on the single sport.
Let me ask you about, I was at a game recently, and that young athlete had a broken arm, clearly a broken arm. What should you do when you have a clear broken arm? Is it right to the ER? Is it hang out, call 911? Is it wait for the trainer? You tell me.
It kind of depends.
Yeah.
Obviously it's going to have to get, if it's it's going to have to get seen in the ER. The benefit of having paramedics come and waiting for an ambulance. I know a lot of the times there's an ambulance at these high school football games. They can administer pain medications. Sometimes it's fast. And, if it was my kid, I'd just scoop him and run and be in the ER in a couple of minutes. But that is the benefit of utilizing the paramedics. And a lot of times people will focus on the deformed arm and miss a secondary injury, which we always try to focus on in the emergency department. So that's kind of the benefit of allowing paramedics to come and evaluate the child and transport patients. They can provide pain control. And then evaluate, make sure there's no other secondary injuries, especially head and neck injuries.
Well, Dr. Medler gave me some advice on that once. You break your arm, you wrap it in a magazine, like an architectural digest.
The main thing, and that's the other thing that either we have so many trainers on the sidelines, or the paramedics. So they have ear splints that will support the arm, especially during transport and everything like that. Because that's the main thing, is we want to support it during transport. So
we've got concussions in the news again. Last week's.
I feel like every fall it's a Tua concussion discussion.
Yeah, let's talk about in the NFL. Tua just got his 4th in a matter of 2.5 years.
I would retire, but he's It seems like each one that happens, it's like less and less energy, which is a lot of times what happens.
Yeah, it wasn't even a direct blow.
No, and that's the thing is people think you have to hit your have a concussion. You really don't with car accidents, whiplash, and just the movement can cause concussions. I mean, he's had enough of them.
Too many,
Made
too
enough
risky.
money and, if it was me, it's easy for us to say. If it was me,
I'd be out.
I probably would have retired after I signed the contract.
Yeah.
Yeah. Now, apparently we can get the COVID vaccine now. Are you recommending that?
Yep. Yeah, and that was going to be my talk next month, but never too early to start talking about COVID vaccines and then influenza vaccines. I think it might be a rough winter in terms of viruses. So we were just talking about scheduling appointments for our two daughters to get their flu shots. And I usually get mine in October, so I'll get my flu and COVID shot in October.
Let me get you another youth sports scenario. Sunday I was at a soccer game. It was hot as hell out. Oh my
It's
gosh,
still
it was
hot,
ridiculous. So, and one of the girls on the other team kind of started hyperventilating, I think, due to the heat exhaustion. What's a good thing to do in that situation?
So cool the patient as soon as possible. So some of the things that can really help are is getting the patient wet or cool rags, especially around the neck. What happens there is it'll cool your carotid arteries off, so that can rapidly kind of help cool. If it's a really serious situation, kind of getting cool and axilla, anywhere where you have arteries or veins that are close to the skin, and shade obviously, and just helping to cool the patient. Then obviously focusing on rehydration at that point. But cool.
I like to know these things because I'm seeing it all the time, and a
It's
lot of people just don't know what to
I
do.
know. I saw it last night too at the cross country meet. There were people that were approaching the runners with bottles of water because they were obviously in severe distress. It was so hot, but you got to keep them hot.
And if you can, the skin wet and a fan help. The evaporation will help aid in cooling too. That's why you see the football side they have those big mist fans because what it does is not only is it cool mist, but once it gets on your skin and evaporate, that aids in the cooling process also. So.
I would just lay down.
I just don't want to put yourself in that situation. It's too hot to be outside. So, but it's supposed to be, I think, 84 the next.
Yeah, we got another week.
Friday night's going to be over 80. Over 80 again. So, it's not stuff that we normally have to deal with this late in the year, but making sure athletes stay well hydrated is important.
Great to see you. Thanks for coming in today.
Thanks for having me again.
Emergency Services physician from IEP in Henry Ford Jackson Hospital, Dr. Jacob Sinkoff. More of the morning show after this.